One of the things that people always want to know, I find, is what do they need to do to get better? What does a patient need to do to get better? And one of the things that's an important corrective factor is helping them make lifestyle changes where their lifestyle may have been contributing to their having a major depression. What kinds of lifestyle changes would you identify there?
Well, I think that's a really good question because like we said earlier, depression is not just biologic. There's certainly a genetic predisposition, but there are also environmental stressors which precipitate and then compound the problems of depression. And I think one of the things that happens when a patient is in treatment for major depression is that he or she is in conversation, ideally, with a psychiatrist or a psychotherapist on a weekly basis so that they can start to evaluate, what stressors in their environment are particularly compounding their depression and how might they change those environmental stressors.
Sure.
One of the things that I focus on is setting aside time for sleep. Oftentimes, people are staying up late at night because they're not feeling able to sleep at that point in time. And then they have to get up in the morning and then they nap during the afternoon. And the napping during the afternoon makes it more difficult then to fall asleep at a steady time. So I do work on sleep hygiene with patients. I encourage them to set a time to go to bed at night, and then we try to use pharmacologic means to get them to sleep at that time so that they're sleeping, this average of 7 hours a night.
Yeah.
In addition, we look at factors like domestic violence. If there's domestic violence in a relationship, that is always compounding the issues of depression. Other issues, drug use or alcohol use, which certainly can compound depression.
Yeah, absolutely.
So in addition to sleep hygiene and being mindful of getting enough sleep every night, what other lifestyle issues do you talk about with your patients?
I try to encourage my patients specifically to exercise regularly because exercise has been shown to alleviate depression. We just feel better when we're exercising because of its effect on our hormones and endocrine system. And we just feel better when we're physically better. Our mental health depends a lot on our physical condition being good. And with regard to diet, I think diet's such an important part of it too, because if people are eating junk food, that can make you depressed in different ways that are increasingly being discovered. If you eat a healthy diet and you eat regular meals, you end up feeling better yourself, and that helps too. Also, supplements are reasonable to try. Sometimes supplements help people, whether it's fish oil or other kinds of vitamins and that sort of thing. There's no one thing that works for everybody, and not everybody gets better because of even a combination of things. So you have to find the right regimen for yourself in terms of your lifestyle.